Vision restoration therapy is meant to restore vision to those who lost vision due to neurological impairments resulting from a stroke or traumatic brain injury. The point of VRT is to stimulate the neurons in between the damaged and healthy cells in order to reactivate those parts of the brain in order to regain vision. NovaVision is the first and leading provider to administer this treatment. The impacts of vision loss due to neurological impairments can have very negative effects on the life of the person suffering from the stroke or traumatic brain injury. They probably find their entire way of life changed. Vision restoration therapy has had a very positive impact on those who have received the treatment for it. There has been an increase in the size of the visual field for most who go through vision restoration therapy. Vision restoration therapy stimulates surviving neurons in the partially damaged zones after a stroke or traumatic brain injury using neuroplasticity of the visual system. The therapy consists of systematic stimulation where the neurons sustaining residual function become more and more activated. By pressing a button when points of light can be seen, it can improve the visual information processing in the area of the residual vision between the healthy and clinically blind visual fields. Vision is then beginning to become restored once these damaged neurons can be stimulated again. Vision restoration therapy has been cleared by the Food and Drug Administration, or the FDA, and is a non-invasive medical device. Even though it is a long-term treatment technique for stroke and traumatic brain injury survivors, it is the first FDA-cleared clinical application of rehabilitation for vision loss. Based out of the Institute for Medical Psychology of the Otto von Guericke University in Magdeburg, Germany, NovaVision is the first and leading provider for vision impairment after stroke and traumatic brain injuries using computerized technology. They use vision restoration therapy to help treat patients with vision impairments caused by neurological problems. They also conduct research and have performed many studies on the visual field impairments. According to the CDC, every 40 seconds someone suffers from a stroke, and nearly 2 million people sustain a traumatic brain injury every year, and that is just in the United States. Of these people suffering from these events, only 16% suffer from permanent vision loss. Up until recently, most clinicians thought the damage to the visual areas of the brain were untreatable because the visual pathways were thought to be hardwired, and therefore loss of visual function was deemed irreversible. Vision loss affects every part of a person's life and can prevent them from doing the activities they are used to doing. The ability to drive is one of the major impacts of vision loss. One loses their independence and may have to quit their job if they cannot get there. Vision restoration therapy resulted in an increase in stimulus detection and shift in border position on suprathreshold perimetry in 74% of those treated. To refer to a personal story, Dan Burke shared his story with Vicor Inc. He suffered from a brain aneurysm that caused him to have 2 strokes. As a result of these 2 strokes, he lost his vision and soon began vision restoration therapy. After about 3 to 6 months, he said that his vision started becoming unblurry and that he could start to see sharper and sharper. Dr. Jose Romano said that about 70% of his patients responded to this therapy and that of those who responded showed about 5 degrees of improvement on average. Vision restoration therapy is a neurotechnology that has allowed for doctors to treat patients that they once were not able to treat before. Through the use of new technology, they are now able to restore the vision of those who have lost their vision due to neurological damage caused by the patient having a stroke or suffering from a traumatic brain injury. This has been shown through the use of facts taken from studies and a person's personal story from someone who had suffered from 2 strokes that had caused him to lose his vision. Doctors now have more options when it comes to treating their patients.